Welcome to Module 4, Understanding Nicotine Addiction. This is Dr. Nicholas Pennings, and this is the Nicotine Cessation Training Program. Nicotine is a substance that rapidly crosses the blood-brain barrier and goes to the brain. There are many nicotine receptors in the brain, but the primary nicotine receptor is the alpha-4 beta-2 receptor located in the ventral tegmental area of the brain. This receptor, once stimulated, sends a signal to the nucleus accumbens, which then stimulates the release of dopamine in the brain. And this is thought to be the mechanism for the addictive behavior of nicotine. And so what we experience here is a cycle. Nicotine creates a sense of pleasure, a sense of enhanced focus and performance, as well as improvement in mood. That sense of pleasure then gradually diminishes after a cigarette use. Tolerance and physical dependence start to develop in the brain. Tolerance is an upregulation or increased number of nicotine receptors, and desensitization of the nicotine receptors also occurs, which increases dependency. There's about a 2-hour half-life of nicotine, so rapid clearance occurs from the central nervous system, which that combined with the decrease in sensitivity of the receptor and increased number of receptor increases the withdrawal symptoms. The withdrawal symptoms are symptoms of dysphoria or depressed mood, irritability, frustration, anger can occur. Appetite increases, causing weight gain. There's difficulty with concentrating. There's cravings that occur, difficulty with sleep, anxiety increases, restlessness occurs, and decreased heart rate. This is what the smoker experiences when the nicotine levels start to drop. And then what happens is they light up a cigarette. And when they light up a cigarette, all those symptoms go away. And then pleasure returns, enhanced performance returns, mood improves. And so the perception from the cigarette smoker is that a cigarette really makes them feel good, that they feel much better. And they do, but they do because they are reversing the withdrawal process. So if they weren't going through that withdrawal process, they wouldn't be experiencing those mood changes, and in turn they would be getting the same benefit from the cigarette. But the perception to the cigarette smoker is that the withdrawal process goes away and they feel so much better when they smoke. And this is one of the things that makes it so challenging for people to stop smoking. So the physical nicotine addiction results in what we call neuroadaptation with repeated exposures. The nicotine receptors increase in number in the brain, which is the upregulation, and then the sensitivity of the nicotine receptor declines, resulting in desensitization. This has a combined effect in physical effect. There's mood enhancement, there's improved mental performance, there's withdrawal avoidance. These are all physical effects of nicotine and reasons why people become addicted. Addiction typically occurs with higher usage. That smokers who are social smokers who smoke typically less than 5 cigarettes a day do not experience significant physical addiction, but the greater the number of cigarettes that are smoked, the more likely you are to be physically addicted. The addiction of nicotine is very powerful, and here we have a graph that compares the withdrawal process of heroin, smoking, and alcohol, and the relapse rate associated with that. And here we see that relapse follows a pattern very similar to heroin, with a high level of relapse occurring within the first 3 months. There is a genetic component to nicotine addiction. Twin studies have shown a high degree of heritability of nicotine dependence, with correlation of the level of dependence and the number of cigarette smokes amongst teens. And there seems to be multiple genetic factors that influence the addiction. But clearly some people are more physically addicted than others. Some of the risk factors for dependency include peer influence, So if your friends are smokers, you're more likely to be a smoker. Parental influence is significant. Children of smokers are 50% more likely to become smokers themselves. Behavioral problems are associated with early tobacco dependence. Personality issues and mental health disease, and particularly schizophrenia, is commonly associated with nicotine dependence. Genetics, as we mentioned, and of great concern is the earlier onset of smoking, the more likely someone is to become physically dependent on cigarettes. So young age is associated with higher levels of addiction. So nicotine is both physically and psychologically addicting. The psychological effects of nicotine include stimulating arousal, enhancing mood, and improving focus and concentration, primarily by stimulating the prefrontal cortex, where executive decision-making occurs. This stimulation decreases reaction time, improves performance. So when these things are occurring, they're enhancing that psychological dependence on cigarette smoking, as well as the desire to avoid the withdrawal symptoms enhances the psychological dependence. What happens also with psychological dependence is that there's a conditioned response that occurs. There's changes that occur in the brain that are associated with the cycling of nicotine use. So this is something called neuroplasticity, or a physical rewiring of the brain, and this is brought about by the recurrent exposure to cues associated with smoking. So smokers will commonly smoke after a meal with coffee or alcohol as a response to stress, to relieve boredom, or in certain social situations. And so the more commonly that these cues occur and then are followed by or associated with smoking, the stronger those associations become and the more automatic that conditioned response becomes. So here we see a cycle of smoking. And this is something that is a chart that was published in a article on nicotine addiction in the New England Journal of Medicine. So a smoking cue occurs, such as stress, which creates a craving, which causes smoking of a cigarette, a spike in nicotine, and activation of the nicotine receptors. That activation of nicotine receptors is causing a release of dopamine, which creates a sense of pleasure, stimulation, and improved mood. But also what's happening is this conditioned response associated with the cues and physical changes occurring in the brain of neuroplasticity. And that as those cues are reinforced, then the craving occurs and smoking another cigarette occurs. But also with the activation of the nicotine receptors, there's a gradual desensitization of the nicotine receptors, which causes the development of tolerance. As the receptors are less active, especially with drops in nicotine levels, there's reduced levels of dopamine in those neurotransmitters, so there is a sense of dysphoria, withdrawal symptoms occur, and stimulate the cravings. So the psychological addiction to nicotine is a combination of withdrawal avoidance and a conditioned behavior brought about by smoking-related cues, as we mentioned, like stress, food, coffee, alcohol, sex, or a sense of reward after completing a task or at the end of the day, relieving boredom, or in certain social situations. When someone stops smoking, they go through physical withdrawal. The physical withdrawal starts fairly rapidly because the nicotine half-life is fairly short, about 2 hours. This withdrawal process typically peaks around the third day and usually is resolved within a week. The symptoms of physical withdrawal include mood changes, anxiety, depression, irritability, difficulty with focus, insomnia, and hunger. As I mentioned, these symptoms typically peak around the third day, and this is an important hurdle for smokers to get over. The third day is when many people tend to relapse because they get the feeling like this withdrawal process is never going to stop, and they give in frustration. And what the things that they need to know is that that response is temporary and will go away. Psychological withdrawal also occurs. This is a more gradual process. The typically peaks around the third week, and again, this is an important thing for people who are in the quitting process to recognize that they will get strong cravings again around the third week and need to work through that. And this is related to repeated exposure to triggers that stimulate craving, and a level of frustration sometimes builds up as they try to avoid that nicotine use and get into a sense of denial and sometimes get frustrated with dealing with those urges. So the fact that it's not well understood by patients is a reason and an importance for support during this time and working with them to get through that period. So in summary, the response of nicotine receptor to the brain produces physical changes in the brain over time. That physical dependency results in significant withdrawal symptoms, which typically peak on the third day. Psychological withdrawal also results in strong cravings, also peaking around the third week. As I mentioned, there's an excellent article on nicotine addiction in the New England Journal of Medicine 2010. Thank you.